Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for Peoria City County Health Department, and welcome to our weekly COVID update. For the Tri-County region, we currently have 55,664 cases to date. That's sadly an increase of 766 cases over 1 week. That brings Peoria to 28,136, Tazewell to 21,329, and Woodford County to 6,199. We increased the total number of deaths by 10 over the past week, and the Tri-County now sits at 860 deaths, including 419 in Peoria, 335 in Tazewell, and 0 in Woodford, staying at 106. We are now inching closer to a number that I hoped not to see again, which is almost close to 1,000 cases at home and isolating in the Tri-County. We currently have 930 active cases at home and isolating, and to give perspective, last week we had only 727. Likewise, last week we had 26 hospitalizations in the Tri-County. We are now at 29. The 7-day average for the Tri-County now sits at 109 cases each day, which is an increase from 88 in the past week. Peoria alone makes up half of those cases, with 52 new cases each day, increased from 48 from the previous week. Regarding our hospitals of OSF St. Francis Medical Center and Unity Point Health Central Illinois, there are currently 20 ICU beds in use for COVID and 60 non-ICU beds in use. That brings our 7-day average from ICU beds to 11 and our non-ICU beds to 47. A lot of questions about why we are seeing these numbers increase, and I think a lot of us recognize that, one, we are moving indoors. And with that, we're getting into closer proximity. We can't socially distance as easily. And sadly, we've stopped using our masking to its full capacity. We're not surprised by this increase. I think we are surprised by how quickly it happened. And so again, as the weather gets colder and we start moving indoors, first and foremost, if you are eligible, and that now means anyone 5 and older, get your vaccine. Wear a face mask. Practice social distancing when you can, and if you are ill, get tested and then isolate away from individuals. Vaccinations continue to be a key part of our response. And to give a little bit of perspective on this, in October, the Illinois Department of Public Health reported 5,000 hospitalizations in the state, with over 90% of them on unvaccinated individuals. More importantly, that included more than half of them being over the age of 65. So if you are in a high-risk group and you are unvaccinated, definitely get your vaccine, as well as if you are vaccinated, get your booster. A lot of the population we saw in January and February getting their first and second doses are now in that time period where they are eligible. And I think Dr. Zike said it best, which is the entire state is in high transmission. There is no low-risk area now in our state. So if you are eligible to get the booster, get the booster. Everything now counts as a high-risk setting. Currently, we just finished up maybe, I guess, a week and a half now of our 5 and 11-year-olds getting their first doses. So overall in Peoria County, 53% of our county is considered fully vaccinated. And as of this morning, 9% of the Peoria County residents ages 5 through 11 have received their first dose of vaccine. And we couldn't do it alone. Our private sector partners such as Walgreens and CVS have been doing vaccinations. The health department has been hosting our own clinics where we've seen over 250 individuals in that age range for their own vaccine. Unity Point Health has done close to 200 vaccinations in their clinic, and they've done 160 in the Peoria School District, and are slated to do even more. Another key partner is OSF, and to talk more about OSF is Sarah Overton, Chief Nursing Officer and VP of Clinical Services.
Hi, good afternoon. Thank you so much, Monica. Really appreciate the opportunity to come and share how OSF is partnering with our communities. So starting back on November 2nd, everyone probably remembers that the FDA and CDC approved for the 2-dose series of Pfizer. And we were privileged to say that we were within 6 days, including a weekend, able to operationalize vaccination in our mass vaccination clinics, which happened throughout the state of Illinois. Specifically, we had 2 large events, one scheduled actually this coming Saturday and one this past Saturday, so I'll share some information on that. You know, really this paves the way for over 28 million children to get vaccinated. We see this as just another layer of protection against what we continue to face, which is a challenging pandemic. Over 8,300 children actually have been hospitalized throughout the country overall with COVID. And although it's not always such a negative outcome for those patients, they are also spreaders of the illness, as well as there have been over 94 patients that were between this age group that were actually resulted in a death overall. So that's really something that we keep as top of mind. COVID-19 is now in the top 10 potential deaths for that age population. So those are some of the stats that we share with our parents, guardians, our children, so that they understand. They are exposed to schools, daycares, sports, and they absolutely play a part in really stopping this pandemic. So what we've done here in OSF in general, we've administered over 1,000 vaccines for our 5 to 11 population. Here in the Tri-County specifically, our event that we had this past Saturday at our endocrinology Knoxville location was 500, just over 500 vaccines. We now have moved into majority of our pediatric medical homes have their Pfizer vaccine. So all of our nurses and our medical assistants have completed the mandatory education, and we are able to serve our patients that come in and see their physicians and advanced practice providers. Many of them have questions and concerns. They worry about side effects. So we are happy to answer and address those questions. I'd like to speak just for a moment as well about our event that's coming up this Saturday. We have plenty of space. We've gotten, again, a tremendous amount of feedback on how well this was. It was run 15-20 minutes in and out the door for our kiddos. As I shared before, maybe the patients were a little apprehensive or crying, but at the end of the experience, they were able to have fun and get a sucker or sticker, and the parents were delighted when they left. We also have our event this coming Saturday from 9 to 3, again at our Knoxville location. We've also hosted a couple clinics in the evenings. We think it's very important to have Saturdays as well as weeknights so that our parents who are working have some accessibility. If you're interested in getting your vaccine, either an adult for our boosters as well as for a kiddo, it's just simple by signing up for OSF MyChart and being able to self-schedule when it's convenient for you. We also have a lot of the data and information that I've just shared out on our website, which is osfhealthcare.org / COVID vaccine. So very important to stay up to date with a lot of the information, and we're sharing as much as we can. We're talking about what we'll do as a next step, but we're hoping to also offer some additional mass vaccination clinics if that need should arise.
For the upcoming one on Saturday, do you have to have an appointment for that one?
You know, we prefer that, yes. I will say that we accommodated a couple walk-ins. So we did have some accessibility to accommodate a few walk-ins, but it's easier and it's a quicker process. A few of our kiddos actually turned 12 in between the 21-day time frame. So we did work through some of those logistics to make sure that if you were trying to schedule for an appointment, certainly reach out to us. We'll help you navigate, but definitely, you know, we'll try our best to accommodate anybody.
Yeah. And another question is, have there been any symptoms from kids who got the vaccine last week? Anything you guys are aware of that?
You know, remarkably, we have gotten very limited feedback. I know others have actually had kiddos in that age range. They do really well with vaccines. I think maybe just general malaise, a little fatigue, probably a sore arm is the one thing that they'll report back to you, or leg, depending on how old and how much that child weighs. But they've actually had great response. Okay, thanks.
And I would just echo, my own 2 children were finally eligible, and one of them went to swim practice that afternoon, so they do respond really well. I think it's also really important, and I appreciate what Sarah has pointed out in terms of the data, and we get a lot of questions from families about the vaccine, especially in the youth. And a lot of the hesitation comes to the fact that they don't see the deaths, and they don't see the severe illness, so they don't feel like it's necessary for their children to get the vaccine. You know, Sarah brought up a great point. They're great at transmitting it to other individuals, especially high-risk individuals like grandparents, loved ones. But also, you know, there is a lot of information about long haulers. So even kids that are asymptomatic or symptomatic that don't need to be hospitalized will still have long-term impacts related to COVID. And so again, we're talking about continuous fatigue, unable to focus, respiratory distress. These are things that can all be prevented by getting the vaccine. So the best way to prevent long haulers and those impacts is getting the vaccine so you don't get COVID in the first place. So again, we recognize that while the severity of the illness may make you question or be hesitant, definitely talk to your pediatrician, your primary care provider, your family medicine. Look at reputable sources online where the data can be cited correctly, but also recognize the fact that it's not just about the long-term severity issues of it, but the fact that they can have these underlying health conditions, and we're learning more and more about long-term impacts of COVID. So the vaccination really is important for that age range, and hopefully in the next few months we'll also see with the addition of younger age ranges as well as antiviral treatments that we can really get ahead of this pandemic. So open up to questions.
Okay, with all these increase in COVID cases that we're having, do you know if these are breakthrough cases or people who are unvaccinated?
So the question is, with all this increase that we're seeing, is it breakthrough cases or unvaccinated? It is primarily unvaccinated individuals. You know, and what we saw compared to cases that we had in the late summer, early fall, again, we were able to do activities outdoors and have airflow, different things happen. As soon as the weather drops, we are inside and closer together. So especially for our unvaccinated individuals, you are now at a higher risk than you were a few months ago because of just how close we are in proximity. So again, getting your vaccine is very important. If it's been on your to-do list but you haven't had a chance, you can come to the health department. We have our walk-in clinics for not only first doses, second doses, but also boosters from 9 to 4 each day. So please take advantage of that.
We're seeing the cases go up or a week up from Thanksgiving. So the difference, I guess, between last Thanksgiving and this Thanksgiving is the vaccine is now widely available. What are some of the do's and don'ts for this year?
So as great questions. We enter the Thanksgiving season knowing what we should look for, what kind of concerns we should have. First and foremost, you know, make sure you have your vaccine, but also if you are feeling ill, get tested, especially when we think about this time where people sometimes write off symptoms as allergies or there's a cold front coming in, so I'm feeling the pressure in my nose. At this point in time, testing is widely available. Take advantage of it because you want to be sure that it is just some other maybe rhinovirus versus actually COVID-19. You don't want to bring and spread it unknowingly. And if you have already received the vaccine and maybe are eligible for the booster, take advantage of getting the booster as well. You want to bring up that immunity level as soon as possible. But it's the same thing, you know, be diligent about your own health and be concerned about the health of those around you. When you're traveling, especially in airports and other congregate settings, wear masks, try to socially distance as much as possible.
What are we seeing with flu activity so far this year? Are you starting to go up a little bit?
We are starting to see flu cases also come into play as well. You know, we did not have as high of a flu vaccination rate as we did last year. And partly, I think a lot of people were able to get the flu vaccine thinking that was a way to help our healthcare system. If you haven't gotten your flu vaccine, also do that. It's still highly recommended. As well as we had better, I think, compliance with masking. and other distancing. So that is, again, the same interventions you would do for flu. So we are seeing an increase with flu compared to previous year, but really we want to look at it maybe for 2 years ago or 3 years ago when we had COVID was in the mix. And in comparison to that, it's relatively the same. Still an issue to be concerned with.
Do you have any numbers on the flu positivity rate or no?
I do not have any numbers with me on the flu positivity rate, but we do work with our hospital systems to report influenza, so that should be available on the health department website.
Some of the other things, like I know the RSV spike this summer, have those started to settle down, or is that still ongoing?
That's still ongoing. I think any sinus respiratory, that's still going to be an issue that is spreading through. So again, with all those type of various viruses moving around, and this is that best time of year for them as well, take advantage of testing to make sure it's not COVID-19. We will not have a press briefing next week in light of Thanksgiving holiday, so we will see you guys in December. Thank you.